And it is, in my view, absurd coming from somebody who's trying to win confirmation for a job that is entirely about making recommendations. These recommendations are going to have life or death consequences for the American people. Mr. Kennedy, if you are confirmed, your recommendations determine which vaccines senior citizens get for free through Medicare. Your recommendation will determine which vaccines are given to millions of kids. Peddling these anti-vaccine conspiracy theories as our chief health officer is going to endanger the lives of kids and seniors across the nation. Just look at what happened when Mr. Kennedy inserted himself into an anti-vaccination crisis in the island nation of Samoa. He traveled there himself to push his views and pour fuel on the fire of a measles outbreak that began due to low vaccination rates. In the end, 83 Samoans died, mostly kids, from a disease that is easily preventable. Americans cannot afford to import this experiment to our great nation. On other healthcare matters, from abortion to universal healthcare, Mr. Kennedy has changed his views so often it is nearly impossible to know where he stands on so many of the basic issues that impact Americans' daily lives. In a gobsmacking statement of irresponsibility, in November 2023, Mr. Kennedy said that he wanted to pause infectious disease research for 8 years. Mr. Kennedy has indicated he's open to restricting access to the abortion medication mifepristone, which remains a primary target of the Republican crusade against reproductive freedom. I took this on back in 1990 when I chaired the first congressional hearing on the topic. The science was clear then. It's even clearer today. Mifepristone is safe. The only reason it's under question in 2025 is because people with a political agenda have been out lying about it. Women deserve to know if Mr. Kennedy will abuse his power as our country's chief health officer to essentially implement a national abortion ban by restricting access to the safe and legal medication. Meanwhile, as the Trump budget office threw the Medicaid program into chaos yesterday, Republicans in Congress are proposing deep cuts to the program that will rip away health care from millions of Americans who count on this vital lifeline. Cuts to Medicaid of this magnitude are going to jack up the cost of health insurance. It'll shutter nursing homes and rural hospitals, deprive seniors and Americans with disabilities of home-based care. That approach amounts to handing over our nation's health system to for-profit insurance companies who've made a fortune delaying and denying care. Mr. Kennedy has virtually no knowledge or experience in handling these issues. It leaves him unprepared to take on a crisis like the nation witnessed yesterday when the Trump budget office shut down the federal Medicaid payment portal. After a careful review of Robert F. Kennedy Jr.'s statements, actions, and views, materials that I have reviewed personally and closely, I've reached the conclusion that he should not be entrusted with the health and well-being of the American people. When he's taken every side of every issue, how can this committee and the American people believe he has anything to say? Let me close by saying I believe more strongly than ever, and I have specialized in healthcare during my time in public service, that we're at a turning point with regard to healthcare in America. If there's one word to describe Americans' feelings towards the healthcare system, it's disillusioned. At every single turn, people feel like they're rolling a load of dice, loaded dice, when they try to get healthcare. Americans are justifiably angry, fed up, and tired of a system that puts profits over patients. Instead of debating meaningful ways to improve Americans' health care, now the committee is being forced to relitigate settled science about vaccines and whether or not the federal government should help Americans get affordable health care. I know where Democrats on this Finance Committee stand when it comes to an agenda to lower costs and improve care. I must say, I cannot say the same about the nominee sitting in front of me. And let me acknowledge, finally, Mr. Chairman, Terry Mills from Portland, Oregon, who is here to represent Nurses for America, and I'd like to enter a statement from her organization into the record at this time. Thank you, Mr. Chairman.
Without objection. Thank you, Ranking Member Wyden. Mr. Kennedy, in a few moments you will be given the opportunity to make your opening statement and respond to these attacks and other questions that the members of this committee have. I would say that with regard to the attack on Medicaid that we just heard, that was a false attack. It's been proven false overnight. The Medicaid portal is operating efficiently today and was never intended to be shut down.
Would gentleman yield, since he's mentioned my name? There was a significant amount of time yesterday where there was bedlam across the country over the status of the Medicaid portals. I hope it's being corrected, but there were problems all through the day.
There certainly were attacks yesterday. The problem has been clarified and the Medicaid portal is fully operational as we speak. Mr. Kennedy, before I turn the time over to you to share your opening statement, I would like to give you a brief introduction. The son of Senator Robert F. Kennedy and nephew of President John F. Kennedy, Robert Kennedy Jr. has been an advocate for consumers since 1985. After graduating from Harvard University, Mr. Kennedy studied at the London School of Economics and received his law degree from the University of Virginia Law School and a master's degree in environmental law from Pace University. He has founded 2 advocacy groups and has spent the last 40 years working to restore and protect children's health. He was a former independent candidate in the 2024 presidential election, and President Trump nominated him this year to be in November of 2024 to be the HHS secretary. In announcing his nomination, President Trump stated, "Mr. Kennedy will restore these agencies to the traditions of gold standard scientific research and beacons of transparency and end the chronic disease epidemic and make America great and healthy again." Before you give your opening statement, Mr. Kennedy, I have 4 obligatory questions that we ask all nominees before this committee. First, is there anything that you are aware of in your background that might present a conflict of interest with the duties of the office to which you have been nominated?
No, Mr. Chairman.
Thank you. Do you know of any reason, personal or otherwise, that would in any way prevent you from fully and honorably discharging the responsibilities of the office to which you have been nominated?
No, I do not.
Do you agree without reservation to respond to any reasonable summons to appear and testify before any duly constituted committee of Congress if you are confirmed?
Yes, I do.
And finally, do you commit to providing a prompt response in writing to any questions addressed to you by any senator of this committee?
Yes, I do.
Thank you, Mr. Kennedy. And before you begin, if you would like to, you may introduce your wife and children.
Yes. My wife, Cheryl Hines, is here. My daughter, Kit Kennedy, my son, Bobby Kennedy, his wife, Amaryllis Fox Kennedy, and my nephew, Jackson Hines, is here, too.
We welcome you all. Thank you. You may proceed with your statement.
Thank you, Mr. Chairman. Chairman Crapo, Ranking Member Wyden, and members of this distinguished committee, I'm humbled to be sitting here today as President Trump's nominee to oversee the U.S. Department of Health and Human Services. I want to thank President Trump for entrusting me to deliver on his promise to make America healthy again. I also want to thank Cheryl and Kik and Bobby and all of my other children who are here today and all the many members of my large extended family for the love that they have so generously shared. Ours has always been a family that has been involved in public service and I look forward to continuing that tradition. My journey into the issue of health began with my career as an environmental attorney, working with hunters and fishermen and mothers in the small town in the Hudson Valley and along the Hudson River. I learned very early on that human health and environmental injuries are intertwined. The same chemicals that kill fish make people sick also. Today, Americans' overall health is in grievous condition. Over 70% of adults and a third of children are overweight or obese. Diabetes is 10 times more prevalent than it was during the 1960s. Cancer among young people is rising by 1 or 2% a year. Autoimmune diseases, neurodevelopmental disorders, Alzheimer's, asthma, ADHD, depression, addiction, and a host of other physical and mental health conditions are all on the rise, some of them exponentially. The United States has worse health than any other developed nation, yet we spend more on healthcare, at least double, and in some cases triple, as other countries. Last year, we spent $4.8 trillion, not counting the indirect costs of missed work. That's almost a fifth of GDP. It's tantamount to a 20% tax on the entire economy. No wonder America has trouble competing with countries that pay a third of what we do for health and have better outcomes and a healthier workforce. But I don't want to make this too much about money. It's the human tragedy that moves us to care. President Trump has promised to restore America's global strength and to restore the American dream, but he understands we can't be a strong nation when our people are so sick. A healthy person has 1,000 dreams. A sick person has only one. Today, over half of our countrymen and women are chronically ill. When I met with President Trump last summer, I discovered that he is more than just concern for this tragic situation, but genuine care. President Trump is committed to restoring the American dream, and 77 million Americans delivered a mandate to him to do just that, due in part to the embrace and elevation of the Make America Healthy Again movement. This movement, led largely by Maha moms from every state, you can see many of them behind us today, and in the hallways and in the lobbies, is one of the most transcendent and powerful movements I've ever seen. I promise President Trump that if confirmed, I will do everything in my power to put the health of Americans back on track. And I've been greatly heartened to discover a deep level of care among members of this committee, too, both Democrats and Republicans. I came away from our conversations confident that we can put aside our divisions for the sake of a healthier America. For a long time, the nation has been locked in a divisive healthcare debate about who pays. Well, when healthcare costs reach 20%, there are no good options, only bad ones. Shifting the burden around between government and corporations and insurers and providers and families is like rearranging deck chairs on the Titanic. Our country will sink beneath a sea of desperation and debt if we don't change the course and ask why are healthcare costs so high in the first place. The obvious answer is chronic disease. The CDC says 90% of healthcare spending goes toward managing chronic disease, which hits lower income Americans the hardest. The president's pledge is not to make some Americans healthy again, but to make all of our people healthy again. There is no single culprit in chronic disease. Much as I have criticized certain industries and agencies, President Trump and I understand that most of their scientists and experts genuinely care about American health. Therefore, we will bring together all stakeholders in pursuit of this unifying goal. Before I conclude, I want to make sure the committee is clear about a few things. News reports have claimed that I'm anti-vaccine or anti-industry. I am neither. I am pro-safety.
We'll have order. Please proceed, Mr. Kennedy.
I am pro-safety. I worked for years to raise awareness about the mercury and toxic chemicals in fish, and nobody called me anti-fish. And I believe that that vaccines play a critical role in healthcare. All of my kids are vaccinated. I've written many books on vaccines. My first book in 2014, the first line of it is, I am not anti-vaccine, and the last line is, I am not anti-vaccine. Nor am I the enemy of food producers. American farms are the bedrock of our culture, of our politics, of our national security. I was a 4-H kid, and I spent my summer working on ranches. I went to work with our farmers. I want to work with our farmers and food producers to remove burdensome regulations and unleash American ingenuity. MAHA simply cannot succeed without a partnership, a full partnership of American farmers. In my advocacy, I've often disturbed the status quo by asking uncomfortable questions. Well, I'm not going to apologize for that. We have massive health problems in this country that we must face honestly. And the first thing I've done every morning for the past 20 years is to get on my knees and pray to God that he would put me in a position to end the chronic disease epidemic and to help America's children. That's why I'm so grateful to President Trump for the opportunity to sit before you today and seek your support and partnership in this endeavor. I will conclude with a promise. The members of this committee, to the president, and to all the tens of millions of parents across America, especially the moms, who have propelled this issue to center stage. Should I be so privileged as to be confirmed, we will make sure our tax dollars support healthy foods. We will scrutinize the chemical additives in our food supply. We will remove financial conflicts of interest from our agencies. We will create an honest, unbiased, gold standard science at HHS, accountable to the president, to Congress, and to the American people. We will reverse the chronic disease epidemic and put the nation back on the road to good health. Thank you.
Thank you, Mr. Kennedy. Mr. Kennedy, I will begin. Each of us will have 5 minutes to ask you questions, and then at the conclusion of the hearing, if there are further questions, there will be an opportunity for those questions to be submitted to you, and I ask that you respond to them promptly. Mr. Kennedy, you have emphasized the importance of nutrition in preventing and managing chronic disease, improving health outcomes, and reducing health costs. I share your interest in the relationship between our diet and our well-being. And if confirmed, I look forward to partnering with you on those efforts. Would you share with the committee why you are passionate about the nutrition-oriented disease prevention and what you have learned?
Yes, Mr. Chairman. I had 11 brothers and sisters. I had dozens of first cousins. I was raised in a time where we did not have a chronic disease epidemic. When my uncle was president, 2% of American kids had chronic disease. Today, 66% have chronic disease. We spend zero on chronic disease during the Kennedy administration. Today, we spend $4.3 trillion a year. With 77% of our kids cannot qualify for military service. When I was a kid, the typical pediatrician would see one case of diabetes in his or her lifetime, 40 or 50-year career. Today, 1 out of every 3 kids who walks through his or her office door is diabetic or pre-diabetic. And the most recent data from NIH shows 38% of teens are diabetic or pre-diabetic. Autism rates have gone from 1 in 10,000 to 1 in 1,500, depending on what studies you look at. In my generation today, 70-year-old men, 1 in 34 in my kids' generation. We've seen this explosion of autoimmune disease, of allergic diseases. This is not just a economic issue. It's not just a national security issue. It is a spiritual issue, and it is a moral issue. We cannot live up to our role as an exemplary nation, as a moral authority around the world, and we're writing off an entire generation of kids.
Thank you very much. And if confirmed, how could we work together to integrate nutrition-based interventions into our healthcare programs like Medicaid and Medicare?
Well, there are many ways that we can do that. The federal funding of the SNAP program, for example, and of school lunch programs could be a driver for helping kids. We shouldn't be giving 60% of the kids in school processed food that is making them sick. We shouldn't be spending 10% of the SNAP program on sugar drinks. So we have a direct ability to change things there. We also, in Medicaid and Medicare, we need to focus more on outcome-based medicine, on putting people in charge of their own health care, of making them accountable for their own health care so they understand the relationship between eating and getting sick. Most importantly, we need to deploy NIH and FDA to doing the research to understand the relationship between these different food additives and chronic disease so that Americans understand it and make sure that Americans are aware of it. I don't want to take food away from anybody. If you like a cheeseburger, a McDonald's cheeseburger, a Diet Coke, which my boss loves, and you should be able to get them. If you want to eat Hostess Twinkies, you should be able to do that. But you should know what the impacts are on your family and on your health.
Thank you. Senator Wyden.
Thank you very much, Mr. Chairman. Before I begin my questions, I'd like to start by entering into the record a letter the committee received from Ambassador Carolyn Kennedy outlining what she believes is Mr. Kennedy's lack of personal fitness for the office.
Without objection.
Mr. Kennedy, you have spent years pushing conflicting stories about vaccines. You say one thing, and then you say another. In your testimony today under oath, you denied that you were anti-vaccine. But during a podcast interview in July of 2023, you said, quote, "No vaccine is safe and effective." In your testimony today, in order to prove you're not anti-vax, you note that all your kids are vaccinated. But in a podcast in 2020, you said, and I quote, "You would do anything, pay anything to go back in time and not vaccinate your kids." Mr. Kennedy, all of these things cannot be true. So, are you lying to Congress today when you say you are pro-vaccine? Or did you lie on all those podcasts? We have all of this on tape, by the way.
Yeah, Senator, as you know, because it's been repeatedly debunked, that statement that I made on the Lex Friedman podcast was a fragment of the statement. He asked me, and anybody who actually goes and looks at that podcast and will see this. He asked me, are there vaccines that are safe and effective? And I said to him, some of the live virus vaccines are. And I said, there are no vaccines that are safe and effective, and I was going to continue for every person. Every medicine has people who are sensitive to them, including vaccines.
Right, so
he interrupted me at that point. I've corrected it many times, including on national TV. You know about this, Senator Wyden, so bringing this up right now is dishonest.
let's be clear about what you've actually done then, since you want to deny your statements. For example, you have a history of trying to take vaccines away from people. In May of 2021, you petitioned the Food and Drug Administration to not only block Americans from having access to the COVID vaccine, but to prevent any future access to the life-saving vaccine. Are you denying that? Your name is on the petition.
We brought that petition after CDC recommended the COVID vaccine without any scientific basis for 6-year-old children. Most experts agree today, even the people who did it back then, that COVID vaccines are inappropriate for 6-year-old children who basically have a zero risk from COVID. That's why I brought that lawsuit. I don't want to, I want to emphasize
Mr. Kennedy, the
I don't-
facts, the facts.
The committee will be in order. And to the audience. Hold on for a second, Mr. Kennedy. To the audience. Comments from the audience are inappropriate and out of order. And if there are any further disruptions, the committee will recess until the police can restore order. Please follow the rules of the committee. Mr. Kennedy, you may proceed.
I also want to point out that your recitation of what happened in Samoa is absolutely wrong, and you know it's wrong, and you know it's wrong.
We'll get to that in a moment. Right now, we're talking about the petition that you filed to block Americans from having access to the vaccine and to prevent any future access to the vaccine. Those facts are on the record. My third question to you is, you made almost $5 million from book deals, mostly promoting junk science. In 2021, in a book called The Measles Book, you wrote that parents had been, quote, misled into believing that measles is a deadly disease and that measles vaccines are necessary, safe, and effective. The reality is measles are in fact deadly and highly contagious, something that you should have learned after your lies contributed to the deaths of 83 people, most of them children, in a measles outbreak in Samoa. So my question here is, Mr. Kennedy, is measles deadly, yes or no?
The death rate from measles historically in this country in 1963, the year before the introduction of the vaccine, was 1 in 10,000. Let me explain what happened in Samoa. In Samoa in 2017 or 2015, there were 2 kids who died following the MMR vaccine. And the vaccination rates in Samoa dropped precipitously from about 63% to the mid-30s, so they've never been very high. And in 2018, 2 more kids died following the MMR vaccine, and the government of Samoa banned the MMR vaccine. I arrived a year later when vaccination rates were already below any previous level. I went there, nothing to do with vaccines. I went there to introduce a medical informatics system that would digitalize records in Samoa and make health delivery much more efficient. I never gave any public statement about vaccines. You cannot find a single Samoan who will say, I didn't get a vaccine because of Bobby Kennedy. I went in June of 2019. The measles outbreak started in August. Oh, clearly I had nothing to do with the measles. Not only that,
Mr. Kennedy,
Senator, not only that, if you let me finish, Senator.
You have had some time,
if you let me finish, Senator, if you let me finish, there are 83 people died. When the tissue samples were sent to New Zealand, most of those people did not have measles. We don't know what was killing them. The same outbreak occurred in Tonga and Fiji, and no extra people died. There were 7 measles outbreaks in the 13 years prior to my arrival.
I just would like to get my time back. The nominee wrote a book saying that people had been misled into believing that measles is a deadly disease. He's trying now to play down his role in Samoa. That's not what the parents say. That's not what Governor Green says. It's time to make sure that we blow the whistle on actually what your views are. At least we're starting.
We need to move
Senator,
on.
I support the measles vaccine. I support the polio vaccine. I will do nothing as HHS secretary that makes it difficult or discourages people from taking either of those
Anybody
vaccines.
who believes that ought to look at the measles book you wrote saying parents have been misled into believing that measles is a deadly disease. That's not true.
We need to move on. Senator Grassley.
Welcome. I'm going to do like I did in my office. I'm just going to make some points to you. I got about 7 I want to quickly get done. And then at the end, I'm going to ask if you disagree with anything I say and then address those things you disagree with. I'll make sure I save time for you to do that. A key responsibility of each member of Congress is oversight. Oversight allows us to hold bureaucrats accountable to the rule of law, and it helps keep faith with taxpayers. I expect HHS to provide timely and complete responses to congressional oversight. Number two, PBMs, something you and I discussed in our office. I've been working to hold pharmacy benefit managers accountable in order to lower prescription drug prices. I expect you to work with us to hold PBMs accountable, and that may even asking your support for legislation that's before the Congress. Drug pricing. Senator Durbin and I have, for a while, been trying to get a bill passed that requires price disclosures on TV ads for prescription drugs. Knowing what something costs before buying it is just common sense. President Trump tried to do this by regulation in his first term. Vice President Vance co-sponsored our bill last Congress. I ask you to support this bill, or if you can do it by regulation, to do it by regulation. On rural health care, the previous administration dragged its feet in opening up slots for rural community hospital demonstration programs. It also ignored concerns from rural pharmacies when implementing changes to Medicare Part D, and ignored rural needs when it comes to distributing physician residency slots. I expect you to prioritize rural Americans' health care needs. On agriculture, in our meeting earlier this month, we talked at length about agriculture. You prefaced the conversation by saying you will not have jurisdiction over these issues. I expect you to leave agricultural practice regulations to the proper agencies, and for the most part, that's USDA and EPA. On dietary guidelines, I've sent letters to the Secretaries of Agriculture at HHS requesting that they provide information regarding conflicts of interest on the Dietary Guideline Advisory Committee to increase transparency. I expect you to provide Congress with confidential financial disclosures from the Advisory Committee before finalizing dietary guidelines, so we know that nobody has a vested interest in it, is having undue influence. Lastly, HHS, Office of Refugee Resettlement Oversight. Last year, I expanded my investigation into HHS's Office of Refugee Resettlement. I wrote 24 contractors and grantees whose job it is to place unaccompanied children with sponsors. In many cases, children have been placed with improper vetted sponsors, placing them at risk of trafficking. The Biden administration's HHS directed these taxpayer-funded contractors and grantees to not respond to my inquiry. This is obstruction by the executive branch. I expect you to produce to me the records and data I've requested and instruct HHS contractors to fully cooperate with my investigation. I also expect HHS to not retaliate against any whistleblowers, including those who identify ORR's failures in vetting sponsors of unaccompanied. You got 45 seconds to respond if you want to.
I agree with all of those provisions, Senator. My approach to administration HHS will be radical transparency. If members of this committee or other members of Congress want information, the doors are open. I've spent many years litigating against NIH and its sub-agencies, HHS and its sub-agencies, NIH, CDC, FDA, on FOIA issues, trying to get information that we, the taxpayers, paid for, and oftentimes getting back redacted copies after a year or 2 years of litigation. That should not be the case, and if Congress asks me for information, you will get it immediately.
Thank you.
Thank you. Senator Cantwell is next, but until she returns, I will move on to down the list, and that would be Senator Cornyn.
Mr. Kennedy, welcome to you and your family, and congratulations. I appreciate Senator Grassley raising the issue of the Office of Refugee Resettlement within the auspices of Health and Human Services. I think this may surprise people, but that's actually the responsibility of HHS, the Office of Resettlement Relocation. Under the previous administration, as Senator Grassley alluded, there were roughly 500,000 children, unaccompanied minors, that were placed with sponsors in the interior of the United States. The previous administration took the position that it was not the federal government's responsibility once these children were placed with these sponsors. But the New York Times, in a series of investigative stories, pointed out that tens of thousands of these children, when they tried to follow up and find out how they were doing, whether they were going to school, whether they were being trafficked or abused, there was no answer, and they took the position it was not their responsibility. So I look forward to working with you to find those children and to make sure that they're not being abused. Millions of Americans are experiencing mild to moderate mental health and substance abuse issues, yet many struggle with timely and effective access. Primary care physicians are most likely to be seeing these individuals as opposed to a specialist, and it makes it important that these individuals, primary care physicians, be trained in patient-centered care, which would strengthen the integration of behavioral health care with primary care services. Is this something that you are concerned about, something you'd be willing to work with us on in order to implement?
Yes, Senator, and let me just reassure you that President Trump has personally spoken to me about locating those 300,000 children who disappeared over the last 4 years.
I don't think anybody has a fully accurate number, but it's hundreds of thousands, I agree.
And many of them we know have been sex trafficked and childhood slavery, and it is a blight on America's moral authority, and we need to find those kids. In terms of addiction services and substance abuse services, this is a priority for me. It was a priority for me when I was running for president during my campaign. I was a heroin addict for 14 years. I've been 42 years in recovery. I go to 12-step meetings every day, so I hear the stories every day. And I hear the many stories about denial of, or the barriers to access to care. And we need to improve that. And to answer specifically to your question, I think we can do that through GME, which is a program that is funded by HHS, that is the largest funder for medical school students. And that's one of the things for primary care physicians should understand addiction care. Addicts almost always go through a cycle where there is a moment where they hit periodic bottoms where they're ready to go into treatment. But it's fleeting and it's momentary. And we have that opportunity to save their lives. And then if we miss that little short window, they're off to the races again.
I appreciate your answer. Our time is short. Let me get to one more question that I think is very important. Under the first Trump administration, the number of people receiving HIV treatment in Africa through the President's Emergency Plan for AIDS Relief, otherwise known as PEPFAR, it increased, this is during the first Trump administration, from 13 million people to 18 million people across 50 countries, primarily in Africa. Africa has about 1.3 billion people today, or in 2021. It's projected to have 2.5 billion people by 2050, or 25% of the global population. In 2020, PEPFAR reported that 2.8 million babies were born without HIV. That was something that would not have happened but for the PEPFAR program. So it has simply been one of the most successful public health programs in the world and saved approximately 26 million lives. Failure to continue this program, in my view, would risk ceding that leadership to adversaries like China And I'd like to know whether you support the objectives and goals of PEPFAR, and would you work with me and my colleagues to make sure that this program continues to provide life-saving antiviral drugs to people who are most in need?
I absolutely support PEPFAR, and I will happily work with you to strengthen the program.
Thank you. Senator Bennett.
Thank you, Mr. Chairman. Thank you, Mr. Kennedy, for being here this morning. And I think that, Mr. Chairman, we are truly through the looking glass this morning here in the U.S. Senate, and this committee is being asked to fulfill a really important responsibility, which is to decide whether to confirm Mr. Kennedy to one of the most important healthcare jobs in America. And the reason I think it's so important is for many of the reasons you said in your opening statement, which is that we live in the richest country in the world, and we have some of the worst health outcomes of any industrialized country in the world. We live in the richest country in the world, and we have some of the lowest life expectancy rates of anybody in the industrialized world. I was a school superintendent before I was in this job, Mr. Chairman, and I can tell you that Mr. Kennedy's right, you know, that when I look at the kids in the Denver public schools, if we don't change the way we eat in this country, 40% of them are going to suffer adult diabetes as a result of their diet. These are, and we're, as I said, spending more than any other country in the world, and our families, every single person's constituents in this Senate are facing chronic shortages when it comes to health care. My friend from Texas, Senator Cornyn, has been a champion on mental health care. We have an epidemic, as he knows, across this country in mental health care, partly because of what the massive social media platforms that were sitting behind the President of the United States have inflicted on our children for their profit in the last decade or so. So we have no shortage of challenges to confront, and I even agree with some of the diagnosis of Mr. Kennedy. What is so disturbing to me is that out of 330 million Americans, we're being asked to put somebody in this job who has spent 50 years of his life not honoring the tradition that he talked about at the beginning of this conversation, but peddling in half-truths, peddling in false statements, peddling in theories that, you know, create doubt about whether or not things that we know are safe are unsafe. Not that every vaccine in America is unsafe, not that you can't possibly have an adverse reaction, but that parents and children in my old school district and school districts all over this country would be better off not getting vaccinated than getting vaccinated. Unlike his own children who were vaccinated, unlike the people he invited to his house in Los Angeles for their party who were vaccinated. For everybody else, it's about peddling these half-truths. And he says it with such conviction that you want to believe him. And Mr. Kennedy, I just have there are many, many things in the record, but I hope that you could answer these questions yes or no. I've tried to ask these in a manner that's faithful to what you actually said, because I didn't want to have a debate about whether you actually said them. So I'm asking you yes or no, Mr. Kennedy. Did you say that COVID-19 was a genetically engineered bioweapon that targets black and white people, but spared Ashkenazi Jews and Chinese people?
I didn't say it was deliberately targeted. I just quoted an NIH-funded and NIH published study.
Did you say that it targets black and white people but spared Ashkenazi Jews?
I quoted a study, Your Honor. I quoted an NIH study that showed that.
I'll take that as a yes. I have to move on, I have to move on. Did you say that Lyme disease is highly likely a materially engineered bioweapon? I made sure I put in the highly likely. Did you say Lyme disease is a highly likely militarily engineered bioweapon?
I probably did say that.
Did you say that?
And that's what the developer of Lyme
I want all of
disease
our
said.
colleagues to hear it, Mr. Kennedy. I want them to hear it. You said yes. Did you say that exposure to pesticides causes children to become transgender?
No, I never said that.
Okay, I have the record that I'll give to the chairman, and he can make his judgment about what you said. Did you write in your book, and it's undeniable, that African AIDS is an entirely different disease from Western AIDS? Yes or no, Mr. Kennedy?
I'm not sure if I made that.
Okay, I'll give it to the chairman, Mr. Kennedy. And my final question, did you say on a podcast, and I quote, "I wouldn't leave abortion, to the states. My belief is we should leave it to the woman. We shouldn't have the government involved, even if it's full term." Did you say that, Mr. Kennedy?
Senator, I believe that every abortion is a tragedy.
Did you say it, Mr. Kennedy? This
believe-
matters. It doesn't matter what you come here and say that isn't true, that's not reflective of what you really believe, that you haven't said over decade after decade after decade, because unlike other jobs we're confirming around this place, this is a job where it is life and death for the kids that I used to work for in the Denver public schools and for families all over this country that are suffering from living in the richest country of the world that can't deliver basic health care and basic mental health care to them. It's too important for the games that you're playing, Mr. Kennedy. And I hope my colleagues will say to the president, I have no influence over him. I hope my colleagues will say to the president, out of 330 million Americans, we can do better than this.
Thank you. We need to move on. Senator Cassidy.
Mr. Kennedy, President Trump has sworn to protect Medicare. Republicans are exploring reforms to Medicaid that could help pay for Trump administration priorities. With this context, what will you do about dual eligibles?
About?
Dual eligibles.
Well, dual eligibles are not right now served very well into the system. Those are people who are eligible for both Medicaid and Medicare. I suppose my answer to that is to make sure that the programs are consolidated, that they're integrated, and the care is integrated. I look forward to working with you, Dr. Cassidy, on making sure that we take good care of people who are dual eligible.
And how do you propose that we integrate those programs? Does Medicare pay more, Medicare pay less, Medicaid pay more, Medicaid pay less? How do we do that?
Well, I'm not exactly sure because I'm not in there. I mean, it is difficult to integrate them because Medicare is under fee-for-service. It's paid for by employer taxes. Medicaid is fully paid for by the federal government, and it's not fee-for-service. So I do not know the answer to that. I look forward to exploring options with you.
Republicans, again, are looking at ways to potentially reform Medicaid to help, pay for President Trump's priorities, but to improve outcomes. What thoughts do you have regarding Medicaid reform?
Well, Medicaid is not working for Americans, and it's specifically not working for the target population. Most Americans, like myself, I'm on Medicare Advantage, and I'm very happy with it. Most people who are on Medicaid are not happy. The premiums are too high. The deductibles are too high. The networks are narrow. Their services have dramatically decreased, even though we've increased the price of Medicare by 60% over the last 4 years. The target population is being robbed.
With that
figure
said,
out other options.
Obviously, you've thought about that, and I appreciate that. What reforms do you recommend, again, that would improve services, I suppose, but also make it more cost efficient?
Well, President Trump has given me the charge of improving quality of care and lowering the price of care for all Americans. There are many things that we can do. What we want to, the ultimate outcome, I think, is to increase transparency, to increase accountability. and to transition to a value-based system rather than a fee-based system,
So on
rather than a
Medicaid,
service-based
on
system.
Medicaid in particular, can you just kind of take those kind of general principles and apply it to the Medicaid program?
Listen, I think that there are many, many options with telemedicine, with AI right now. And, there's including direct primary care systems. We're seeing that movement grow across the country. There's one of the largest providers.
So going back to Medicaid though, and speaking of these specific advances, what reforms are you proposing with these ideas vis-a-vis Medicaid?
Well, I don't have a broad proposal for dismantling the program.
Of course not saying that.
I think what we need to do is we need to experiment with pilot programs in each state. We need to keep our eye on the ultimate goal, which is value-based care, which is transparency, accountability, access.
And one more thing, going back to Medicare, you mentioned you're an MA. You mentioned earlier the Medicare fee-for-service. Do you have any kind of thoughts as to whether or not patients on fee-for-service should move into MA, or how should we handle that?
Whether patients
who are on Medicare
and
fee-for-service.
traditional Medicare,
Yes.
that's their choice right now. We have, I think, 32 million Americans, or 30 million Americans on Medicare, on traditional Medicare, and then another 34 on Medicare Advantage, roughly half and half. And I think more people would rather be on Medicare Advantage because it offers very good services. But people can't afford it. It's much more expensive. Oh, in answer to your first question, there are all kinds of exciting things that we can be doing, including cooperatives, which President Trump has supported, including health savings accounts, which President Trump has supported. All of these things to make people more accountable for their own health.
And so we'd bring the cooperatives and the health savings accounts into Medicare and Medicaid?
Exactly. We try to increase those, the use of those, and to direct primary care, to continue to transition into a value-based program that is private. Americans don't, by and large, do not like the Affordable Care Act. People are on it. They don't like Medicaid. They like Medicare, and they like